Hi, I'm Maria Alatalo, physical therapist with Reliant Medical Group. I've been with Reliant for 17 years. I specialize in foot and ankle dysfunction, but today I want to talk to you about something else I'm passionate about, the diaphragm. This is a muscle we use every single day without giving it a second thought. So why aren't we training this muscle like we do so many other muscles in our body? Let me give you a few reasons why we should. Breathing is essential to core stability and posture. A strong diaphragm can help prevent incontinence, it can improve GI function, it can improve balance and posture, lower blood pressure, reduce anxiety, decrease pain, and enhance athletic performance. So let's first talk about proper diaphragmatic breathing technique. When you're doing diaphragmatic breathing, you want to start by inhaling through your nose and feeling your lower ribs expand upward and outward in a fashion much like an umbrella would open. When you exhale, you want to think about blowing slowly and completely out your mouth through rounded or pursed lips. And as that happens, you should feel the rib cage shrink down and in once again. So why don't we practice a couple repetitions of this technique? I'm going to keep my hands on my rib cage here so that you can see that movement occur. You want to try to minimize any motion in the chest, neck, and upper shoulder area. All right. Great. Now that we've got the technique down, let's talk about a couple ways you can perform strengthening for this muscle. The first way, I want to grab a balloon. So just a regular balloon here. We're going to take 3 consecutive breaths, inhaling through the nose and blowing out into this balloon. After each exhalation, you want to plug the balloon by either using your fingertips or your tongue. And each time you want to think about inhaling through the nose, those ribs expanding up and outward. Let's give it a try. Great. This is something that you can perform sitting at your desk at work, when you're at a stoplight, in your car, or just at home. All right, the next exercise, I'm going to have you grab a piece of resistance band or TheraBand. You want it to be long enough that you can put it around your back, around that lower rib cage, and then you're going to pull forward with your arms. You want there to be some tension in the band as you pull forward so that when you inhale through the nose, your ribs are going to push up and out against that resistance. So let's give this one a try as well. You can also increase the tension by pulling your arms a little bit farther forward or using a different color higher resistance band. Great. So I hope I've inspired some enthusiasm and excitement about training this muscle. It's something that does require practice and consistency, but can have a huge impact on improving how you breathe, how you move, and how you live. Thanks for breathing with me today. I'm Maria Alatalo, and this is my Medical Minute.